for our Friday coffee talk. Dr. Nucci from Nucci Medical, and I do have my coffee, and it actually is very nice today. It's always very nice, but particularly nice today. Today's topic is on aging and the spine. Aging and the spine. Well, there's things age, right? The spine ages also. The spine is a little bit different than the other joints of the body. When you age, particularly people concerned and talk about arthritis, you get arthritis in your knee or in your shoulder, or your hip, and you may need injections or knee replacement or shoulder replacement sometimes. And the spine also ages, but it's a bit peculiar. We don't fully understand degenerative changes in the joints. The original common wisdom, knee arthritis and so on, or shoulder arthritis, it's overuse. You use a joint, you use a hinge on the door, it wears out over time. And similarly, a joint will wear out over time. You just keep using it and using it and using it. There's more to it than that. And the reason we know that is because some people get arthritis in their knee and others don't. Or some people get significant arthritis in early age and others don't. Or even one gets significant arthritis in one joint, hip joint on one side, and they don't on the other side. Or they don't have as much on the other side. And so there's a genetic component also. Some people just don't get that much arthritis in a particular joint, and maybe another joint they do. So there's a disconnect a bit between just overuse and just, hey, things just get older and you wear them out, and that's sort of it. So, and that's similar in the spine, for example. It is not unusual for you to see significant, as I did the other day, very significant degenerative changes, arthritic changes in someone's neck. It was quite significant. And their low back had virtually nothing, completely benign. Looked like it was about 20 years old, and their neck looked like it was about 80 years old. So there's something else going on here. The neck and back, I tell patients, are different animals, so they work differently. You may get something one place, you don't get another place. But that doesn't explain it either entirely. For example, look at someone's low back. They may have significant degenerative changes at one level, and the other ones are fine. Or there's one level is very, very bad, and the other one's not so bad. So the overuse idea doesn't really quite work. There's some genetic component to it. So like everything else, the spine does age, but how it ages and the parts of it age are varying, even in the same individual, and certainly between individuals. The spine is also unique in the sense that you're dealing with two different kinds of cartilage. They're not the same. In the knee joint, you're dealing with essentially hyaline cartilage. It's joint cartilage for a peripheral joint. The spine does have joint cartilage. It has it in the back, in the facets. I'll have my model here in front of me. I didn't plan to bring it, but here it is. Here's the spine. There are joints in the back here on the spine, one on each side. They're called facet joints. There's one at each level. There's multiple levels in the spine. Allow the spine to bend and move. I can see that a little bit, bending and moving. That kind of cartilage is like knee cartilage, same kind of makeup, same kind of physiological component of that cartilage. This is a model of a disc. It doesn't really show it in the sense of cartilage. It's more show disc herniations. When you press on it, the thing pops out. So that's our disc herniation model. But this is a different kind of cartilage here. It is cartilage, but it's different than this one. It's a different kind of cartilage. And that makes a difference because they degenerate in different ways, essentially. The main point, I think, when you're talking about aging of the spine is pain. So some of your spine gets old, who cares? If it doesn't bother you, you can move and do everything you want. What does it make if it ages? Really, you're talking about, pain. And again, the spine is unique in this way. If you have knee arthritis, and let's say you have significantly bad knee arthritis in one knee, and it's not so bad in the other knee for whatever reason. Generally, the knee with more arthritis generally hurts more. But that's not the way it is in the spine. You can have significant degenerative changes in one area, and it's not painful at all. And in another area that it's not as bad, or maybe it is, it's just as bad, and that one's the painful one. So again, there's a somewhat of a disconnect here. So the disc, different kind of arthritis, the degeneration of that disc, of the disc itself, works in a different way than degeneration of the joints, which are right behind it or right more superficial, as I showed on the model. So you have different kinds of cartilage, different kinds of arthritis, different kinds of degeneration throughout the spine that is essentially unique to the way the spine works. So what does this really mean? There's all of this stuff together. Well, the spine ages, and you look at it and you say, oh, look, there's arthritis there. The point is that it may not be significant, may not be painful, may not need surgery, may not need shots, may not need anything. And often it does not need anything. So you must not be distracted by an X-ray finding or an MRI finding that notes degenerative changes or in the joints, the facet joints, or in the disc. If you have pain, that's easy to see on an X-ray. You say, I have pain in my back. Oh my goodness, look at there's arthritis, right? That's it. That's not the case. It may be, but it may not be. It's not as simple. Not that the peripheral joints are simple, but it's not as simple. It doesn't run the same way. You must be very diligent in figuring out what's going on. Another example would be someone with degenerative scoliosis. In other words, their spine is so degenerated at multiple levels that it's actually bending. It's sort of twisting because of the arthritic changes. They hurt. Someone says, I have heart pain. And you look at this bad or curve and it's all arthritic. And you go, oh my goodness. And well, I got to straighten that out. I mean, clearly that's it, right? Well, not necessarily. It may be. But it may be just one level is painful. So of all those levels that are arthritic and bent, maybe just that one spot, and you may be able to treat just that one spot for pain. And you have to be, again, very diligent, figure out why are you hurting, and the degeneration, the arthritis doesn't correlate. Now, just a sort of an aside here on degenerative scoliosis, it's a deformity. So you might want to have it straight for other reasons, right? It's not necessarily pain. You may be bent. You want to straighten it out for other reasons and give a normal curve and so on. But you must be concerned or must be aware that the aging spine and the painful spine are not the same thing. They don't correlate, one to one. And if you see degenerative changes in the neck or the back, it may be one of the reasons they're hurting or patient's hurting, but it may not be, or it may be one of the reasons. And one should not, as a good spine surgeon, not get distracted by what you see immediately on the film and go right to that. You need to investigate the causes, of things. So bottom line, spine does age. It ages in different parts, potentially different ways. That is not well understood between two people. One might have a very degenerative spine, another one may not. Completely different ages. The older person may not, and the younger person may, for reasons we don't fully understand. And as I said, neck, back, different animals. What you see in the neck may not translate to the back, and one must be diligent. So if you get an X-ray or an MRI that says, hey, I have arthritis, don't let it, throw you off. It may be a red herring, so to speak, or it may be an issue. One needs to investigate it further to know. As far as so maybe someone will ask this, I'll beat them to the punch. How to stop your spine from aging? No good way of doing that, other than the normal things are eat well, exercise, and so on. There's some evidence to suggest that running and walking gets nutrients to the discs and is good for the discs, and maybe that might help didn't stop the spine from degenerating. But there really is no good way. There are techniques people try, and maybe that's another talk, injecting things into the disc to try to get it to regrow. Some success in that, but as I said, there's a disconnect between the pain and the degeneration. You get the disc to look better. It doesn't mean you're going to be less painful. It doesn't really correlate as well as we would like. So that's an area of research still, working on that. But don't get thrown by spine aging. Your spine is going to age, but it may not be something that you need to be concerned about as far as pain and disability goes. So that is the aging spine. I don't know if we have any aging spine questions. We might have aging spine questions. I will drink my somewhat aged coffee. It's not that old. Just make it, but I'll drink it anyway. I like coffee that sits around for a while. I like aged coffee, actually. Like any good surgeon drinks aged coffee. Um, Residency. Let's see. Can one part of the spine age faster than the other? And I sort of alluded to that earlier, and the answer is yes, it can. When you're saying aging, you're saying degeneration, disc getting narrower, spurs forming on the joints, and so on. And yes, one can age faster or degenerate or look older or whatever the word you want to say than another part of the spine. And even within one part of the spine, one area can be significantly more degenerative than another. Now, I did mention that it's somewhat varied. The levels that are used more per se, in other words, the levels of the low back that move and bend more, the lower couple of discs, the levels of the neck that move and bend more, the middle of the neck, tend to degenerate more than the levels around it. So there is a motion, there is a use aspect to this also, but it's not a one-to-one thing. But if they're going to see it, those are the levels you're more likely to see it because of the use, but use isn't the overuse, or use is not the entire answer. Let's see. Exercise, and that's hard labor. Hard labor, working on the railroad, hitting the spikes. I don't think they do that anymore. But in any case, heavy labor, throwing boxes or bags or carrying heavy sacks or mail, or doing, construction work, we may be lifting things, this kind of thing, or any job that you're lifting and twisting. Will it degenerate the spine faster? There is some evidence, at least in the low back, to suggest heavier labor, heavier work does lead to degeneration of the spine. Faster, all things being equal. But again, it's not a one-to-one. I can think of a particular patient as a farmer. He was very hard worker. His spine was nearly pristine at like 70 years old. It was amazing. How could that be? Genetics, one does not know. But yes, heavy labor is associated. There's no causation here. There's an association with more degeneration, all things being equal. Whether it's painful, again, as we discussed earlier, that may not be an issue. But the degeneration is it seems to be more likely in patients, people who do heavy labor than not. The neck, no good literature on that I have seen. It's more low back they've concentrated on with that one. Let's see if we have any other exciting questions. I think we may have killed it. Let's see if there's anything else. Oh, it seems to have covered all of the questions. So hopefully your spine will not age and not be painful, or will age. It's going to age, but hopefully it will not be painful. It shouldn't be. So don't get thrown by that on an X-ray or MRI. And maybe one time we'll talk about X-ray and MRI findings and what they mean. I spend a great deal of time unexplaining MRIs to patients, what things they say and what they say and what it means is very different. So I know patients like to get their reports and look at them themselves and so on. And they do get concerned about many of the things they see on the MRI reports, particularly since they can be extremely long and all kinds of. Generally, a lot of it is probably irrelevant most of the time. Some of it is relevant, and that's where you go to a specialist to interpret these things. So maybe that's another talk someday about the findings and what you should be concerned about and what not. In the end, it comes down to the symptoms that your patient has and how you examine and interpret those symptoms. Anyway, that is today's aging of the spine. So I will drink my somewhat aged coffee, and we will talk next week on another. I don't know what the topic is next week. I haven't looked at it yet, but maybe you guys can suggest a topic, and we'll cover it next week. All right, thank you. Dr. Nucci, Nucci Medical, signing out from, I was Seattle. I don't know, maybe it's not Seattle anymore. Wherever I am, signing off. Talk to you next time.